Hello, my name is Juliana Holcomb, and I'm a clinical research coordinator in the Division of Child and Adolescent Psychiatry at Massachusetts General Hospital. I'm also the lead author on a manuscript entitled Beyond Initial Screening, 1-Year Follow-Up of Adolescents with Internalizing Problems on the Pediatric Symptom Checklist, which was recently accepted for publication in the Journal of Developmental and Behavioral Pediatrics. Directed by Dr. J. Michael Murphy and Dr. Michael Jelinek, our lab at MGH investigates psychosocial screening with the Pediatric Symptom Checklist, or the PSC, in diverse pediatric populations, both in the US and internationally. We are so excited to share some of our findings with you today. Our JDBP paper reports on a 1-year follow-up of adolescents who were screened for depression using the internalizing subscale of the Parent Report 17-item Pediatric Symptom Checklist. The screen was electronically administered via iPad tablet prior to patients' well child visits in one mixed socioeconomic clinic, the MGH Revere Healthcare Center, located in Revere, Massachusetts. In the current study, we were interested in investigating whether screening with the PSC's internalizing subscale was feasible, successful in increasing behavioral health service referrals for at-risk adolescents, and effective in decreasing depression symptoms over the course of 1 year. Given the deleterious impact of adolescent depression on both individual and interpersonal outcomes, many standard-setting organizations have recently put out depression screening recommendations to be given to all adolescents at their annual physical exams. While the PSC's internalizing subscale has been validated for this purpose, this is the first study to track internalizing scores among adolescents over time in a pediatric outpatient setting. The PSC is made up of 3 subscales that assess for internalizing, externalizing, and attention symptoms, as well as an overall scale that rates general psychosocial dysfunction. This form is available in over 3 dozen languages on MGH's website. In the current study, we looked at data for 637 adolescents with well child visits 2 years in a row, between January 1st, 2017 and December 31st, 2018, at Revere Healthcare Center. Of these patients, approximately 94% had electronically completed PSC-17 screen at both well child visits. Within the sample, 11.6% screened positive or at risk at their first screen, and 14.9% screened at risk at their second screen. Patients who scored at risk on the first screen were over 9 times more likely to receive subsequent behavioral health services compared to patients who were not at risk. However, the results also illustrated the persistence of internalizing symptoms over the 2 years of this study, with approximately 2/3 of patients scoring at risk on the internalizing subscale at the PSC at both visits, which were approximately 1 year apart. This persistence of risk was still seen among patients who accessed behavioral health services after scoring at risk on their first screen. However, we did find that the rate of referral to these services was significantly higher for the patients with the most impaired internalizing scores on the PSC, suggesting that pediatricians might be taking the subscale into account when making mental health service decisions. In summary, our study demonstrated the feasibility and the utility of screening adolescents for depression with the internalizing subscale of the PSC during their annual physical visits. We also found that most of the at-risk youth were still at risk 1 year later, even among those who had received mental health services. This study supports the new guidelines that recommend routine screening for depression among adolescents in pediatric primary care. We hope you have the opportunity to read our manuscript in the Journal of Developmental and Behavioral Pediatrics. Thank you so much.